Coronavirus facts and myths. The coronavirus is now referred to as COVID 19. The illness is now called COVID 19. COVID stands for coronavirus, the D stands for disease, and the number 19 refers to the year the virus was identified, in 2019. You might be concerned about keeping yourself and your family healthy and safe. There's a lot of information circulating around, so it's important to know what's true and what's not. To help you better understand what's happening and cut through the confusion, here are some common myths clarified with information from the Centers for Disease Control and Prevention and the WHO. Both organizations are working with experts on learning more about the virus. Myth: a vaccine to cure COVID-19 is available. Fact: there's no vaccine for the new coronavirus right now. Scientists have already begun working on one, but developing a vaccine that is safe and effective in human beings will probably take months. Myth: you can protect yourself from COVID-19 by swallowing or gargling with bleach, taking acetic acid or steroids, or using essential oils, salt water, ethanol, or other substances. Fact: none of those recommendations protect you from COVID-19, and some of these practices may also be dangerous. The best ways to protect yourself from this coronaviruses and other viruses include washing your hands frequently and thoroughly using soap and hot water, avoiding close contact with people who are sick, sneezing, or coughing. In addition, avoid spreading your own germs by coughing into the crook of your elbow and staying home if you are feeling sick. Myth: the new coronavirus was deliberately created or released by people. Fact: viruses can change over time. Occasionally, a disease outbreak happens when a virus that is common in any animal, such as a pig, bat, or bird, undergoes changes and passes on to humans. This is likely how the new coronavirus came to be. Myth: ordering or buying products shipped from China will make a person sick. Fact: researchers are studying the new coronavirus to learn more about how it affects people. As of this writing, please note that most viruses like this do not stay alive for very long on surfaces, so it is not likely that you will get COVID-19 from a package that was in transit for days or even weeks. The illness is most likely transmitted by droplets from an infected person's sneeze or cough, but more information is emerging daily. Myth: a face mask will protect you from COVID-19. Fact: certain models of professional, tight-fitting respirators, such as the N95, can protect healthcare workers as they care for infected patients. But for the general public, the benefit of wearing lightweight, disposable surgical masks is not clear. Experts say they may provide some protection from large drops, sprays, or splashes, but because they do not fit tightly, they may allow tiny infected droplets to get into your nose, eyes, or mouth. Also, people with the virus on their hands who touch their face under a mask might become infected. People with respiratory illnesses can wear these masks to lessen their chance of infecting other people. People of Asian descent, including Chinese Americans, are not more likely to get COVID-19 than any other American. Help stop fear by letting people know that being of Asian descent does not increase the chance for getting or spreading the COVID-19 virus. You can help stop COVID-19 by knowing the signs and symptoms. Signs and symptoms include fever, cough, shortness of breath. Please seek medical advice if you develop any of the symptoms. And also remember, if you have been in close contact with a person known to have COVID-19 or live in or have recently traveled from an area with ongoing spread of COVID-19, call ahead before you go to a doctor's office or emergency room. Tell them about your recent travel and your symptoms. There are simple things you can do to help keep yourself and others healthy. Wash your hands often with soap and water for at least 20 seconds, especially after blowing your nose, coughing or sneezing, going to the bathroom, and before eating or preparing food. Avoid touching your eyes, nose, and mouth with unwashed hands. Stay home if you are sick. Cover your mouth or sneeze into a tissue, then throw the tissue away immediately in the trash bin.